The COVID-19 pandemic resulted in a global public health crisis. In early 2020, in response to the pandemic, the governors of all 50 U.S. states declared states of emergency. Shortly thereafter, states began enacting other policies to help stop the spread of the virus. But here's where states began to differ.
Governors varied in the number and timing of executive orders they issued. Most, but not all, issued stay-at-home orders. Many governors also enacted mask mandates, closed certain businesses, and required social distancing. Because policies varied from state to state, we assessed potential differences in COVID-19 cases and deaths.
We analyzed national and daily COVID-19 infection and death rates from March 15 to December 15 of 2020 across all 50 U.S. states and the District of Columbia. We found that states with Republican governors had, on average, more COVID-19 cases per capita starting in June and higher death rates starting in July, after controlling for potential confounders such as rurality, comorbidities, and environmental factors.
For example, on June 28, 2020, infection rates were about 1.7 times higher in Republican-led states than Democrat-led states. Similarly, on August 5th, death rates were 1.8 times higher in states with Republican governors compared to states with Democratic governors, and this trend continued throughout the year.
Although these differences cannot be attributed to governor party affiliation alone, political beliefs may have contributed to policy decisions that impacted the spread of the virus. Republican governors tended to impose restrictions, such as stay-at-home orders and mask mandates, for shorter periods of time, which may have affected the number of COVID-19 cases and deaths.
The COVID-19 pandemic unfolded at a time of deep partisan divide in the U.S. This resulted in public health messaging and decisions by state and federal leaders that were guided at times by political expedience. Moving forward, it is critically important to separate politics from public health.